Tell me what you, Adam, I want to start with you. Tell me what you think is most powerful with what you're doing, and how do you become part of that office's culture?
If I can make a personal connection, right, get to know their kids, or about their kids or their family, what vacation, where are you going on, what, just things like that. They're way more likely to open up, right, share personal things with you, and then they're way more likely to listen to what you have to share about your product. So that's something that I've been trying to do a lot more of over the last little while, and I think it's really helped to open up doors.
It's not just you have a great product, you still have to have that relationship and the practices that you are able to have that relationship.
Yeah, I mean, they're buying from me personally, right? Yeah, it's Crest Oral-B, and it might be the best products in the world, but I'm the face of Crest Oral-B, right? And I need to represent that.
And when you come into my practice, I want to hey, Adam, what's up?
Yeah,
good to see you.
Right.
That's
right.
Instead of who are you?
Yeah, exactly.
Awesome.
So, anyway.
That's a good point, Mark.
There are a couple kind of questions in there, but just as a rep as I go, and I try to respect the time. I don't ever remember a time sitting in an office for an hour waiting to talk to anybody. I mean, that's the last thing.
But that happens.
It happens a lot. I know some reps who do it. And to me, it's just that back to what Stu said about being that trusted advisor. I mean, I'm honest with people. I'll tell people, hey, this product is going to work for you. This isn't going to work for you. And so there's times when I say, hey, it's probably not a good fit for you to join the co-op. I tell them, they look at me and kind of surprised. So gaining their trust is huge, and giving them honest advice and having integrity is really, really important to me. And even if it's, saying, a competitor's great, and they do a really, really good job. And so it's just gaining that trust, and it's different with a cold call as it is with an existing account. But I had an office call yesterday and asked me 4 questions on things that we don't even do. Like, what's your advice on this? And so I know I've hit a home run with that office. Because they're just looking for me saying, hey, thanks for that information. Thanks for telling me about that. And they weren't services that we offered at all, but just to gain that trust with them.
Mm-hmm. I think one thing that helps me get to move out of that salesperson role into the trusted advisor role that we talked about is a willingness of the doctor to be open with me and allow me to build a relationship so that we can earn that trust with each other, right? But it's difficult if that doctor is not, or if that dental office is not willing to open their doors to us as salespeople, as reps. It's almost impossible to break through that barrier, which is why I'm glad we're having this discussion, because there are bad reps out there, right? That'll sit in the office for an hour. There are reps out there that'll waste a doctor's time, not bring value, or there's selfish reps out there that just want to push their own agenda. And I think those are the ones that give all of us in this industry a bad reputation, a bad name. I mean, I'm sure you guys have been burned by some of those reps.
Oh yeah.
And I feel like if I can bring value, if I can understand your struggles, and if we can be open with each other about what we're really experiencing in the practice, we can help each other out. It's got to be a win-win situation, right? I mean, I don't want to bring anything to your practice that's not going to help you grow or help you be more profitable, especially with like the MPMB side of what you guys do, right? There's dental offices where I've tried to bring that, and they shut us out. It's like, we bang our heads against the wall. Like, I know this is going to help you out. Like, all the conversations we've had and all the struggles you're telling me that you're going through, I have the solution, but you're not trusting me. Like,
it's the lead the horse to water thing,
right?
Yeah, absolutely.
It's frustrating, but and then there's times where, like, remember when you bought your CAD cam and your cone beam from me? Well, what was my line to you? Rob, can I talk you out of this? Like, are you sure this is gonna be a good thing? And
that's true. You did. You tried to talk me out of buying both of them at the same time, and I remember
driving home from that trip and like going, "How much did you spend on that?"
But that's because
it's a good purchase.
But that's because I knew that you had latched onto the right solution for your practice.
Yeah.
And if I could talk you out of it, you weren't talked into it yourself. You hadn't seen the vision if I could talk you out of it.
What was really fun too is she just said, go play with Prime Scan, because I was using another product, another CAD CAM system at the time, and it's like, and you're like, just go play with it and see if it works for you, and if it doesn't, great, and if it does, great.
Yeah.
And it's like, I appreciate that. And yeah, he did. He tried to talk me out of buying both of them at the same time, but man, I just saw the value of both those. And now,
and the time had to be right for you. You had to be in the right mentality to say, okay, I need to look into it. I need to really experience it. I need to think for myself on it. And you made that decision in confidence, knowing that he wasn't going to pressure you one way or another. And I think the soft sells is such a powerful skill to have versus just high pressure, hard sells all the time. I'm the person that is going to completely push that away from me because I don't like being.
And Michelle, you'll appreciate this being a hygienist. It doesn't have to be hundreds of thousands of dollars of equipment. Exactly. It can be Servitech that, hey, you should try this. Give this a shot. I've got some docs that are really liking this, and look what it does for you hygienists. Of course, you're not a practicing hygienist anymore, but you know what I mean? It's like, it could be big, but it can be the small things. So
absolutely.
I want your thoughts.
I think for a lot of us as sales reps, we get pegged like we're coming in to sell you the cheapest cotton roll, right? Mm-hmm. And that is not what gets us up in the morning and out the door, the excitement and the passion to sell another cotton roll for less money, right?
That's a good point.
If I could just get that out there, what gets us out and going is seriously making a difference out there. And I know that sounds cliche and cheesy, but if we can take a doctor who's struggling financially and get him into a place where he is profitable, happy, able to take care of himself and his family, that is what brings us the most joy and passion and gets us up in the morning, not the cheapest cotton roll. So for us, I enjoy being the quarterback for my doctors, for all things, not just dentistry. If he's needing a new marketing person, I love being the quarterback and finding that tool for him to help, him market his practice and himself and his dentistry so that he can grow and get more patients. If it's his office needs health insurance and his family needs health insurance, bringing in Help Side or other tools in our tool belt, right?
Right.
That is what is exciting for me as a dental sales rep.
I'm thinking of two offices just off the top of my head that you brought to us to train, and one of them she's just crushing it now, and the other one, that guy is, you've changed their lives, and I it's not just bringing them to us for training, but it's the instruments, it's the meds, it's the cotton roll. I mean, it's everything that you're doing for them. I hope that that all the dentists and team members that are watching this discussion, I hope that they get a better perspective of what all these reps and the tens of thousands just like them nationwide, what they have to do and what their job is, and that you just hit it on the head. You're not just trying to bring them, the cheapest cotton roll. You're trying to bring them a quality of life that maybe they have not tapped into yet.